Buoy Health Insights, pale skin around the lips. Welcome to another episode of Buoy Health Insights, where we dive deep into health topics and provide you with a better understanding of your symptoms and potential causes. Today, we're tackling the topic of pale skin around the lips, an unusual change that can sometimes be noticed. If you've observed a lighter complexion, particularly in this area, you might be wondering why it's happening and what it could mean for your health. Let's start by discussing some of the potential causes of this symptom. One possible culprit could be vitiligo, a condition where white patches develop on the skin due to a loss of pigment from affected areas. Vitiligo is thought to arise from an autoimmune response, where your body mistakenly attacks healthy cells responsible for your skin color. Typically, there are no other symptoms apart from the visible changes in skin appearance. Another cause could be vasovagal syncope, which is one of the most common reasons people faint. This happens when your body reacts dramatically to certain triggers, like the sight of blood or intense emotional stress, leading to a sudden drop in heart rate and blood pressure. As a result, your brain gets less blood flow and you might briefly lose consciousness. Pale skin around the lips can be a sign of this as blood flow to the area decreases. Iron deficiency anemia is also a key cause to consider. This condition means that your body doesn't have enough iron to form hemoglobin, the protein in red blood cells that carries oxygen to your body's tissues. Iron deficiency anemia can be brought on by various things: significant blood loss, chronic bleeding from ulcers or menstrual periods, problems absorbing iron from food, or simply not consuming enough iron-rich foods. Symptoms of this condition go beyond pale skin and can include overwhelming fatigue, shortness of breath, difficulty maintaining stamina, and a fast, irregular heartbeat. It's particularly concerning because if left untreated, it can lead to serious heart problems and developmental issues in children. If you're seeing pale lip skin coupled with any of these other signs, fatigue, paleness elsewhere on the skin, or nausea, it might hint at the underlying cause. Fatigue can be especially telling as it's common in both iron deficiency anemia and vasovagal syncope. Now, when should you seek medical care? If the paleness around your lips is accompanied by symptoms like chest pain, rapid and irregular heartbeat, a recent episode of fainting, or other significant changes in your health, it's important to consult a healthcare professional. They can thoroughly examine and guide you toward the appropriate treatment, whether dietary changes, supplements, medications, or other therapies. To manage vitiligo, a doctor might prescribe steroid creams to prevent the patches from spreading or suggest other treatments like prescription creams and UV light therapy. With vasovagal syncope, often no treatment is necessary, but it could be worth discussing with a doctor, especially if fainting episodes are frequent or cause injuries. Iron deficiency anemia usually calls for increased iron intake through diet and supplements, with severe cases possibly requiring hospitalization for blood transfusions or intravenous iron therapy. Remember, the contents discussed here are not to be substituted for professional medical advice, diagnosis, or treatment. Always reach out to a healthcare provider for personalized guidance based on your health conditions and symptoms. Before signing off, if this information was helpful to you, don't forget to like and subscribe for more health insights. Stay informed, stay healthy, and see you in the next video.